first meeting of the Committee on Aging. Bobby, would you call the roll, please?
Peggy Bellin.
Here.
Claude Benedict.
Here.
Lurton Blassingame.
Here.
Ron Durkop.
Here.
Sandy Kleckel.
Here.
Judy Ritchie.
Here.
Julie Maslowski.
Here.
Deb Allison Osby. Jean Wallerman.
Here.
Okay, thank you. Everyone should have had a copy of the minutes from last month. Are there any additions or corrections? If not, we'll take a motion to approve.
Move. So move.
Any discussion? All those in favor?
Aye.
Opposed? Okay, moving on, are there any statements from either of our two guests? Okay, all right. And next, Julie, would you introduce our guest, please?
Sure. Today we have Denise Parrish, the Chief Administrative Officer from Mercy Hospital, joining us to discuss what's new at Mercy.
Thank you. Julie asked me to come and give you an update about what's going on at Mercy, and so I'll start back up a little bit. I am Denise Parrish. I'm the Chief Administrative Officer. I'm also the Vice President of Patient Care Services. So I have been at Mercy for 20 years. I worked at the old hospital, started actually as a CNA in the float pool. So I've pretty much worked in every department in the hospital or managed the departments in the hospital. So it is very near and dear to my heart. We have become part of Ascension, Wisconsin. Ascension is the largest nonprofit healthcare organization in the United States, with I think it's 23 states that have Ascension hospitals. So we have been through a great deal of change over the last 3 to 4 years. I can't even keep track because it just seems like it's been a crazy ride. I was appointed as the Chief Administrative Officer in February. Things are slowing down and beginning to feel a little bit more normal. So Mercy's been in the community for 127 years, and our mission is to serve those most in need, especially the poor and vulnerable. So it's with that I come to work every day. It's knowing that if we don't exist, there are people that will go without medical care. As a nurse, I was always, Pollyanna. Like you went to nursing school and they talked about how great it was to be a nurse, and then you get out and reality kind of sets in, and it becomes more about payments and making the bottom line. But at Mercy, I always felt I didn't have to worry about the patient I was taking care of. I didn't have to know what type of insurance they had. And truly, that's why I stay and why I continue to fight and why I continue to work to make it the best hospital that we can in Oshkosh. So what's going on? I told you we're kind of slowing down with the changes, becoming more stable, becoming incorporated within Ascension. It's been, really, if you think about it, we integrated 4 healthcare systems into one over the last 4 years. It's kind of like a startup company. It's really about changing everything from the ground up, from our HR to how we order supplies, what kind of computer system we're using. So it's been difficult, I will be the first one to say, but people are catching on and we're getting into our groove, so it's nice to know that. Do you guys have any questions about the integration with Ascension or what that means for us as a state or community? I'm pretty transparent, so you can ask me anything. My goal is really to get the word out about Mercy and what we stand to bring to the community. So.
May I ask you a question?
Sure.
How come, you said Mercy, I can remember you call it Affinity, you call it different names after a while. I don't know what we're talking about.
Exactly. And we jokingly refer to ourselves as a Finneman Ascension. So we were part of Affinity Health System, which was St. Elizabeth's Hospital in Appleton, Mercy in Oshkosh, and Calumet over in Chilton, yes. And so then we were owned by two groups of nuns, the Sisters of the Sorrowful Mother and the Wheaton Franciscans in Milwaukee. And then I'm going to screw up the timeline, but I'll do approximately. Approximately 5 years ago, the Wheatons sold their portion to the Sisters of the Sorrowful Mother. So we became solely owned by the sisters. And then we became part of Ministry Healthcare. So that was very short-lived. It was maybe a year or 18 months that we were Ministry Healthcare, and then we became part of Ascension, Wisconsin. So that's why we lovingly call ourselves a Finneman Ascension, because we have transferred ownership or partnerships quickly within the last few years. So,
Thank you.
yes. So when we changed our name, we used to be Mercy Medical Center, and I was really kind of anxious about the name change. I thought it would upset the community that we changed our name. But the first time that I announced the name change was to our 25-year club. So everybody who's been worked at Mercy for 25 years or more, we have an annual dinner. And I told them that, and they said, oh, that's okay. That's what we used to be called. So we were Mercy Hospital until 1968. And then we owned or bought an extended living facility. So that's when we changed our name to Mercy Medical Center. So it is kind of going back to our roots. So thank you. Any other questions?
Denise, what separates you or sets you apart really from Aurora? Both pretty close together physically.
Yes, physically, yeah, and I mean, our quality and our patient satisfaction scores are very, very similar. Mercy is a 5-star hospital. Aurora is a 5-star hospital. So it is really hard to differentiate ourselves from them. But I really think the one thing that differentiates us is our ability to care for the poor and vulnerable, and our mission to do that. We, don't turn anyone away based on their ability to pay, and that's really the differentiator between Aurora and us.
What year was that when you people moved from over?
2000,
2000?
yes.
Oh my God, that long already.
Yes, 18 years already. Can you believe that?
Oh, I can't.
I feel old, like how did that time go by? So, any other questions about the changes at Mercy? And then I wanted to just present to you what we're adding to our facility, which is very pertinent to the Committee on Aging. Ascension Mercy Hospital is adding a geropsych department this year. Geropsych, yes. So, key points, it's initially going to be an 8-bed unit on the 5th floor of the hospital. Currently, the 5th floor is empty. It is a unit of Ascension Mercy Hospital, and I'll explain why I point that out later on. Construction has started. We need to be ready by July 1st. We'll have 2 more phases of build-out, which will increase the ultimately to 25 beds over the next couple of years. The jobs have been posted and training has already been started. So what is geropsych? It's what type of patients are on a geropsych unit. Geropsych units are departments of a hospital that focus on treating mental health and psychiatric disorders in older adults, usually 60 and older. So currently those patients are being treated on our adult psych unit. And I'll explain why this is necessary. These patients whose disorders are assessed as primarily due to mental illness, patients with cognitive, emotional, and behavioral problems that require care and treatment in a secure inpatient setting. Patients who are younger than 60 can get admitted, but it's based on the criteria of the unit. So currently, these patients are put on an adult psych unit, and typically the average length of stay is 3 to 4 days. Well, the problems of these patients is typically that their meds need to be adjusted, and they need a longer length of stay. And we don't allow that to happen on our adult psych unit. So this unit, the average length of stay is 10 to 12 days. I've even heard up to 14 days. And it gives us time to adjust the medications and really get to the root cause of the problem for these older adults. Typically, there's many medical problems that these patients have. There could be interactions with medications, or it could be that the medications no longer work for them. It could be kidneys don't work as well as they used to, so maybe there's an increase in the excretion of medications, or their livers are not working like they used to just because of changes with age. So this will really give us an opportunity to lengthen that stay and focus on what's causing the issues. So this was really shocking to me. The oldest age group is growing, but the supply of psychological support is dwindling. 1 in 4 adults aged 65 and older experience a mental health problem, such as depression, anxiety, schizophrenia, or dementia. I just was shocked by that. And people 85 and older have the highest suicide rate of any age group, especially among older white males who have a suicide rate almost 6 times of that of the general population. So when you think about the need, just reading the statement is justification for this unit. It fills a missing service line in all of Ascension's service areas. Presently, there's only 2 existing geropsychiatric units in Wisconsin, and they total a total 20 beds. So when we are finished, we'll actually double the existing beds available in the state of Wisconsin. It fits the strategic needs with the numerous senior services that Ascension offers, as it's acute care, hospitals, and long-term facilities, and it improves the delivery of medical care to seniors by treating often present mental health diagnosis. So Signet Health is a corporation that we're actually partnering with to get this off the ground and running. They are based out of Denton, Texas, with operational support in Dallas, Chicago, Little Rock, Atlanta, and Raleigh. They're business support, so they help us make sure that we're compliant with regulations and policies and procedures, and help us get off the ground with filing necessary paperwork. They do not own the facility, and the people that work there are Mercy associates.
When did you first sign up with Signet?
So the contract was signed right before Christmas of last year. So we partnered with them, and then January and February was a lot of preparatory work, assessing the best site within the hospital for this, working with our contractor, architecture, filing paperwork, which is abundant, and then construction started in March.
So they don't own their own facilities, but you provide facilities.
We provide facilities, and they have, we pay like a monthly fee to them that help. They just basically help guide us through the getting started phase. And then eventually, I believe, once we're on our feet and have it running, the contract will end. So yes, the unit will be a part, and Signet will assist Mercy in recruiting staff, marketing, and outreach for referrals. So they, psychiatrists are hard to come by. Currently, the psychiatrists that we have can meet the needs of an 8-bed unit, but once we increase that to more than 8, we'll need additional psychiatric needs. And Signet has a better recruiting plan some reason they can recruit psychiatrists better than pretty much anybody in the country. So really, that's a huge benefit of working with them. They also, part of the fee that we pay will assist in marketing and community education, so we can get out there to the various nursing homes and facilities to tell them what we can do, how to triage which patients qualify or certify for this department. Any questions?
Denise, do you expect that this will be sort of a regional catchment area then for?
Yeah, initially I see it with 8 beds. I think Oshkosh can fill up the 8 beds. And then once we expand to 25, I think it'll be more of a regional asset to the region. But initially 8 beds, I've talked to various nursing homes and assisted living facilities, and they basically said we could fill you up tomorrow. So, any other questions?
This organization help people with Alzheimer's disease too, is that?
They will have patients with Alzheimer's, but primarily that's not the focus. Some of the patients will have depression with Alzheimer's. It's more of a psychiatric disorder that they will get admitted for. But it's not to say that patients
What's the
with
difference then between it? I mean, Alzheimer's, I know you lose your energy or parts.
right. We're looking for patients that will benefit from medication management or stabilization or changes in medications. Where patients with Alzheimer's, there's really there might be patients that with Alzheimer's that will end up on our unit, but Alzheimer's will not be the primary diagnosis for care.
Thank you.
Are you prepared to work with the correctional system? There was just an article with the Journal Sentinel of the number of older adults in the correctional facilities already who are facing some pretty major health issues.
We do work with the Department of Justice, especially with Oshkosh. We have a lot of different correctional facilities, and that is a concern of theirs. And we have always partnered with them, and accepted the prisoners as patients. It just adds a little creativity to how we do that. So, any other questions that you guys have?
I know that the Winnebago County Department of Human Services, Adult Protective Services are always looking for more resources for emergency protective placement options.
Right.
Do you see this unit as
Typically,
that to some degree?
it could be utilized. Typically, the patients that are admitted on this unit, they're planned admissions. They're identified within the nursing homes or assisted livings as potential patients. It's kind of a more of a controlled admission. You're brought in with your family or loved one or support system, and there's an intake process that occurs. Not to say that emergency management is out of the question. It's just not the primary. Yep, but if somebody comes into the ER and they're identified and they're medically cleared, they could be eligible for that unit. It is a secure, locked unit, but it's specially designed for the older population. So, yeah, I would love to give you a tour when it's done and completed. So if you're interested, please reach out to me. Julie knows how to contact me, and I would love to give you a tour of the facility. So we're looking for mid-June. It will be ready with a start date of July 1st. So that's our beginning of our fiscal year.
How long did people stay there? That's not like being in a home, is it? I mean,
No, it's 10 to 12 days typically.
Okay.
Yep. But I've heard, 10 to 12. I've heard 14. So it's somewhere in that range that they're typically there. Yeah, the problem is typically when we get these types of patients in, the nursing homes typically don't want them back because of maybe aggressive behaviors or stuff like that. So it's our job to communicate to them that the patient or the person you sent us is not the person we're returning to you. So that'll be on us to help the nursing homes understand that.
I understand that.
Yeah, and take those people or those patients back, so. Yeah. Any other questions or concerns? All right, I appreciate your time and I appreciate you allowing me to come. I'm sorry for the delay with the technical difficulties, but I hope it was beneficial to you all. So,
Thank you.
Thank you very much.
Thank you.
Thank you.
Okay, moving on, committee reports, strengthening our partnership with neighborhood associations and other partners. Jean?
And nothing to report at this meeting?
Okay, improving access to affordable transportation and delivery services for seniors. Peggy?
Claude, Judy, and I met on the 18th, kind of switching our focus a little bit to delivery services, and we're feeling that we really don't have a lot of options for seniors for groceries, pharmacies, meals. I mean, we have Advocap now for meal service. We have, I think, Hometown does pharmacy, and I'm not sure if there's
Amro
others.
Pharmacy.
What?
Amro
Amro
Pharmacy.
also does. But groceries, we have the ability for a pickup from Walmart, and we're hearing Pick and Save also does pickups, but not a lot. If you can't drive or you can't get picked up.
I know that Piggly Wiggly has some service because
delivery?
I don't know if they deliver or they put together, but I've seen them filling the carts
Okay.
for different customers.
So those are the things that we're looking at. We also felt sometimes with Walmart or those other deliveries, online ordering could be difficult for people who don't have a computer, don't have a charge card. So is there anything further that places can do for that? And is there, we also, we're gonna talk to Teresa or somebody else from somebody from the ADRC to see if there's like a bus that goes grocery shopping and picking. Can take a large group of people, but we didn't think there was those options available. So those are kind of the areas that we're looking at right now, and if anybody knows of anything, to please let us know, and then we can communicate it more.
Right. We also got a little creative in our thinking. There's several individuals that walk regularly, like at Walmart, in that if we could somehow find out who these people are, partner them with someone who is homebound, that they could, if the order was called in or somehow just delivering that order to the home. The other thing is that the community pantry does have a very limited amount of service that they use volunteers who will deliver groceries to the homebound, primarily in Amro in Winnie County, mostly the housing units, and that is very helpful to those individuals. A lot of what I hear from the seniors is their concern about what's being picked for them is not what they really want to have. So that's one of the things that we have to do some education on both sides. Any other?
Yeah, I think this would be one of the areas in which the neighborhood associations could work. You're my neighbor and you don't drive. I'm going shopping. Why don't you let me know? I've already done this in our little unit in Oshkosh, and it works pretty well.
We do the same thing in our apartment building.
Okay.
And it's kind of important to note that there's large areas of the city are what are called food deserts, that there are no grocery stores close by. And they may be able to pick up a few things at one of the gas stations.
For more money.
Yes, the cost is more. But they're having to pay for the convenience. So there's lots of opportunities out there. It's a matter of getting everything to match. Okay. Creating a community design and policy that supports an age-friendly community. Lurton?
Yeah, I have a list of the neighborhood alliances, and I've sent basically a note to 5 of them as a check, saying essentially our mission and the neighborhood association mission is very much the same, to improve the quality of life of Oshkosh residents. And 2 of the neighborhoods have come back. I'll be meeting with both the Menominee South shortly and Millers Bay probably in a couple of weeks. And at 10 o'clock, I'll be meeting with Shelley Ranke, who's in charge of the Go Neighborhood Association. So we're on the way. And what I'd like to do right now, if we could, is what do you on the committee think would be something that I should ask them to get information from them, and what should we tell them that we can offer or help with them? A little bit about what you would like to see me do when I'm with the neighborhood associations.
I sit on the Menominee South Neighborhood Steering Committee, and right now we're looking at initiatives for the next year, things that we want to work on as a neighborhood. And so I think going back to what you said about checking in on your neighbors, seeing if they do need things from the grocery store while you're out, I think that would be a great thing to present and discuss with them.
I think another thing would be informing them a little bit about the work of the Committee on Aging, the Oshkosh Committee on Aging, and that it is a committee that's televised, and we do share a lot of information, and that's a source of them getting information that's current and in terms of things that are coming up, and programs like we just heard, services that are available in the community. I think that'd be one way to help get the word out, if you would encourage them to tune into the Committee on Aging meetings.
And actually, along that line, if they share with us the dates of their meeting, they're not there may be somebody sitting at home in that neighborhood that's not attending a meeting, but hearing it again, that, okay, our group is meeting on such and such date. We can provide a phone number if the committee, that particular association wants it. And that can be shared through our venue here also.
Good, thank you. And I'd also like to have Bobby Joe give me some of the currents from the Oshkosh Senior Center, to pass out at 3 or 4 of them at each neighborhood, so they would, some of them may or may not know, probably don't know, how much is available already.
Our strategic plan would also be a good piece to share.
And you're doing a strategic plan.
Yes, correct. Our Menominee South Neighborhood Association is doing a strategic.
Right, but what I was saying is the Committee on Aging plan, or even parts of the city strategic plan, would be helpful. Because the more we share back and forth, the more progress we're going to make.
I like the idea of sharing the curtains with those individuals, and maybe just having those point people for the neighborhood associations have more resources available for their neighborhood, whether it be more information on the ADRC, that they, when they identify somebody that might need a little bit more help, that they can refer them to the appropriate channels.
The other thing I would do besides the current is the ADRC pamphlet, so they would know about that. And I can simply stop by and pick up some there.
Right.
We can give you, though, Bobby can give you some of the ADRC books also.
Good.
And the new ones will be out the beginning of September. Okay, anything else along that line? All right. Improving communication and visibility of available services to seniors. Ron?
There are several events coming up. Are these going to be on the screen, by the way?
They should be.
Okay. The first one is the Caring for the Caregiver. It's a free conference sponsored by the Aging and Disability Research Center and the Long-Term Support Division of the Winnebago County Department of Human Services. And it's an annual event. This is being held this year on Thursday, May 17th. It's going to be held at the UW Oshkosh Alumni Center, 625, it's not up just yet, but 625 Pearl. Free parking, it's from 8 o'clock in the morning until 3 in the afternoon. And the focus is taking care of caregivers. We know that people who need long-term care, whether they're young people or older people, are in deep trouble if their caregiver is not doing well. So the focus of this conference is to provide information and resources and encouragement to caregivers. And the program calls for, in the morning, a panel for children, focusing on child care, that is. Parent connections, children and youth with special health care needs, parent advocates, and children's long-term support will be on the panel. The keynote speaker, and some of you will remember this gentleman, Martin Schreiber, who was former governor of Wisconsin. He is the keynote speaker, will be on at 11, and from 1 to 2:30, an adult panel focusing on adult issues. Attorney Ben Adams, who's elder law specialist from NINA, will be on the panel along with Options for Independent Living, Memory Cafe, and the Aging and Disability Resource Center staff. So again, that's Thursday, May 17th at the Alumni Center on the UW campus, and from 8:30 to 3. You do have to register. So, and that registration is required by May 15th, and I guess that's on the screen. So anyway, you register through Nancy Rudinger at the ADRC at 236-1220. That's 236-1220.
This would be the kind of thing that we could share with the neighborhood associations just
Absolutely.
automatically.
This kind of thing would be very helpful to them, sure. And it's always good to know that food will be available, door prizes, free chair massages, and there are vendor booths, so there'll be a lot of agencies providing information about their resources. So that's one event coming up. Another that we'll be talking about for the next couple of months, and that's the Winnebago County Wheelchair Wash. This has been done in the past, and we're going to do it again this year. It's Friday, June 22nd from 10 until 2. It'll be at the Oshkosh North High School West parking lot, and they would like people to register through Making the Ride Happen, and that's at 920-225-1719, 920-225-1719, and you don't have to register, but it helps. You're going to wait a little longer if you're not registered, I guess. So there's going to be music, food, and an inspection and cleaning of wheelchairs. So those who are...
What day is it?
Pardon me?
What day was that?
The day is Friday, June 22nd.
June 20th.
Yeah,
Thank
from
you.
10 until 2, Oshkosh North High School. And I think we have that on the screen too, so people will be able to see that.
Would you have both of those given to Bobby?
Yes.
Okay.
She has those already.
Oh, good. So if somebody calls up and they have a question, you... Okay.
And the other event actually coming up fairly soon too, that is germane to what Denise was talking about earlier, the National Older Adult Mental Health Awareness Day is being held on May 18th. And I believe this is the first National Older Adult Mental Health Awareness Day. If you're going to attend this, you need to go to Maryland, Rockville, Maryland. So not many of us are going to make that, but you can participate in this on the web. So it's a free conference, and you can register. And I think okay, that information is being posted also, but it's being put on by the Substance Abuse and Mental Health Services Administration, the Administration for Community Living, the National Coalition on Mental Health and Aging, and again, that's Friday, May 18th, 2018, from 9 o'clock in the morning to 11:30. So it's a 2.5-hour program. Just a couple of things that they shared with the registration. I have registered for this, so I want to participate in the online edition. In a 2012 study from the Institute on Medicine found that nearly 1 in 5 older adult Americans have one or more mental health substance use conditions. Although they comprise only 15.2% of the U.S. population, older adults account for 18% of suicides in 2016. And as was reported earlier in Denise's presentation, males 75 or older have the highest suicide rates of any age group, and almost double any other age group. So this event is designed to raise public awareness around the mental health of older adults and spur actions to address their needs by promoting evidence-based approaches to mental health and substance use prevention, treatment, and recovery, supports for older adults, and elaborate between the mental health and aging networks, or collaborate, I should say, between the mental health and aging networks. It'll also highlight the work where we can seek treatment and services, so it'll be focusing on that area as well. There's a link to participate, there's a link to register. I'm not sure the best way to get that out. If people are able to access the video of this, can they access any linkages? Probably not, huh? I'm not sure of the technology that.
If they actually got a close view of this, it would have
Yeah.
everything.
Yeah.
Otherwise, they can contact the senior center, Bobby, and she'll
Okay.
have that.
Okay. Because there is a link to the online participation. So, okay. And you do need to register for that as well. So, again, that's being held on May 18th from 9 until 11:30 Central Time. So,
Julie, do you have anything?
No, I do not.
Okay. All right. We have been talking about the new Medicare cards that are being issued and the scams, and I believe we have a video that we'd like to show. Just a minute while Jake gets it for us. Ron, correct me if I'm wrong, the new cards will be started in June?
starting to come out in June in Wisconsin.
Right.
Not
So,
sure exactly when they're going to get finished in Wisconsin, but they thought maybe a couple of months.
okay. And Jake has the video? Okay.
Not all beneficiaries will receive the new cards at the same time, causing some confusion and opening the door to scams. Beware of anyone who contacts you about your replacement Medicare card. The Center for Medicare and Medicaid Services says that it will never ask a beneficiary to confirm a Social Security number or ask for money as a condition of getting a new Medicare card. For more information about this and other scams, visit aarp.org/fraudwatchnetwork.
That was put out by AARP. There was also a very good one that was done by WBAY with Sarah Thompson. We were hoping to get permission to air that, but you can go on the WBAY website and look for that information. So,
What's the reason of getting a new card for? I mean, what was wrong with the old card? I mean,
because it put your social security number out there for identity theft. Because if you look at your current card, that has your
I gotta
social.
have my picture now taken on that Medicaid card, huh? I don't have it on the old one.
No, your picture isn't on there. It'd be a combination of letters and numbers
Okay.
that make no sense to you, but will protect your identity.
Okay, that's what I want to know.
The only current Medicare cards that don't have the individual person's number on before this have been like the surviving spouse collecting survivor benefits. And that would be the Social Security number that the account is drawn on. So mine is safe. Okay. We also, Ron and Claude and I attended the council meeting last month and received the proclamation for May as Older American Month. Nationally it is. It is in the city now. Well received. And you'll be able to see that the proclamation as it's passed around. Our next meeting date is June 5th. We don't have a clearly identified speaker, but we will have a speaker. And at that meeting, we'll also be electing new officers or at least the discussion of it for this committee. And on that note, unless there's any other business, I'll accept a motion to adjourn.
So move.
Okay.
All those in favor?
Aye.
Opposed? Meeting adjourned.
Good.